Hello, I'm Amelia Reynolds. First tonight, more questions about the quality of healthcare in this region. The trust which runs mental health services for Norfolk and Suffolk is being investigated because of the state of its finances. It's currently £1.7 million in debt and heading for a £3.7 million deficit by the end of the financial year. And a separate investigation will be carried out at the Norfolk and Norwich University Hospital. Patient care is under the spotlight there. In particular, problems meeting waiting time targets for A&E, operations and some cancer care too.
The Norfolk and Suffolk Trust is fighting to cut its deficit. Mental health nurses now work alongside police at Norfolk's police control room.
I think clearly he does need some treatment. He does need, sort of a period of time.
When the call comes in, they can quickly ensure that mental health patients get the right advice when they contact the police. That saves time and money. But at the Mental Health Trust's recent annual meeting, it warned it faced a massive deficit, £3.7 million by next April.
Acute hospitals get more money for more work, mental health trusts don't. So we're doing more work, but at the moment we're not seeing more resources.
Unbelievably, in mental health, there are no rights to access treatment within a defined period of time. And that lack of balance distorts where the money goes, and it ensures that money always goes into physical health rather than mental health. And that's why it's so important to reform the system to ensure that mental health gets its fair share.
The Mental Health Trust here in Norwich isn't the only one under the spotlight. Monitor is also carrying out a separate and unrelated investigation into the Norfolk and Norwich University Hospital. The hospital's been told it's missed 3 key national waiting time targets for accident and emergency, some cancer care and operations.
I think everybody feels very, very busy. We have been very busy for quite a while, and I think it's really tough when you're working on a ward or in accident emergency or in the acute medical unit. You feel that pressure 24 hours a day, 7 days a week, and it can feel relentless.
Other hospitals are also feeling the strain. Last month, Basildon Hospital's A&E department was put on black alert. And faced with too few beds and too many patients, Colchester General also declared a major incident. The government says it's pumping £300 million into the NHS to get it through the winter. But for some NHS Trust bosses, the winter blues have come a little early. Alex Dunlop, BBC Look East, Norwich.
Well, Emma Corlett is from the union Unison. She's also been a mental health nurse for the past 15 years. Earlier she told me it's worse now than it's ever been.
What's happened is that the ring fencing has disappeared. The money that we are given to run services has gone down and demand has increased. And I think our frustration is that was just so predictable that in a recession we know all the things that bring people into contact with mental health services are there. You could have predicted that our referrals were going to go up, so we've been cut at a time that people need us most.
So is it simply a lack of resource? You say resources, I say money.
Yeah.
Or is it bad choices about where that money is being spent?
Fundamentally, it is a lack of money. We wholeheartedly support our Chief Executive, Michael Scott's, pointing out that if we were funded in the same way that acute hospitals were, we would have £30 million more. If Norman Lamb's serious about parity of esteem, then that needs to be parity of funding. If you're not going to fund us in the same way, then you need to accept that our services are going to be poor, and the consequence of that is that people don't get the care and treatment that they need, or in the worst cases, they end up taking their lives.
There is a risk then that patients will suffer.
People have been suffering already. We've had people that can't get into the service or that haven't got a bed available when they need it. We come into work and we want to be proud of the care that we deliver, and it's frustrating, it's professionally embarrassing, and it doesn't make you feel good when you know you've gone home at the end of the day and you haven't seen as many people as you've been able to see, or you've got people on a waiting list who nobody is seeing. That's just not acceptable.
Emma Corlett, thank you very much.
Thank you.